3D models felt a lot more realistic. So drilling into them felt a lot more like drilling into bone rather than drilling into stone or cast.
This model really mimic the tissue as is. You can feel it with your hand. All the instruments that you use, it's feel the same as real tissue. The value of using this model before they starting to make the real practice in patient is very high. And I think this is the game changer when you are start to use these models before you start the real practice.
I would definitely rather these models rather than cadavers or animals. First of all, it feels more ethical, but just the fact that it's very clean and I can just take it everywhere I want. I can actually practice this at home. Just the fact that you have different types of models to practice from helps me to take each problem and just do it repeatedly. If I mess it up, it's fine. I can just take another model, do it again. And then I can take every scenario and try to master it before moving on to the next one. It really helped me to gain confidence because I gained the practice to do it.